more interactive, and answer those and kind of try to address those more practical and the solutions that we have through our medical field that we can, provide for you, inshallah, today. So with that, I will let Dr. Khan start with introducing what does anxiety and mean, and what is exactly a panic attack, and how it would look like, or how it would just present, as we would say.
Thank you, Nudrat. Can you hear me?
Yes, I can.
Okay, just checking the slides. Okay. Assalamu alaikum, everybody. And this is, anxiety is a very strong topic. We hear about it all the time, and there's a lot happening right now, and it definitely creates a lot of anxiety among us. And I just wanted to kind of briefly talk about it, but these are the slides I presented once before with anxiety in children, and I'm going to kind of go through it, and then we'll talk a little bit about panic attacks, and we'll kind of go into detail about things from there. So, and then we'll have this more interactive. So if you guys have questions, I'm going to see if I can probably pull up those questions the way my screen shows up, Nudrat. So I'll have you look at the questions and tell me. Yeah, so we'll
Yes,
talk.
no problem. I'm probably going to interrupt you in between, but we'll go from there. We'll
Right.
be able
Okay,
to
inshallah.
monitor
So
the
we'll just make it more interactive. And I'm going to just talk about really defining anxiety and panic attacks to start off, and then we'll have more an engaging conversation, inshallah. We've talked about this. This is what I do. A lot of my time is really do anxiety, depression in adults, a little bit of paranoia, psychosis. Psychosis means having bad thoughts, delusions, feeling like you're thinking too much, and hearing and seeing things. But the most common part of what a psychiatrist does is depression and anxiety. And anxiety, right? I define anxiety as really like cough and medicine. You have cough, you go to the doctor, and you're like, here it is. It's as common as a cough. It's an internal sense of worry, dread, fear, a normal response. And sometimes people like, I don't have any reason to be anxious. And often it's that people have kind of gone through problems and stuff, and then later on they present with this, and there's no specific cause to it. I often define anxiety as actually a good thing too. So there's a good anxiety and a bad anxiety, right? So if you kind of look at it from a very evolution point, human beings were really hunters. They were out predators there and stuff like that. And we kind of survived because we had this gut intuition, you call it, or you feel like, okay, something bad's going to happen, so I got to protect myself. So I feel like anxiety is somewhat a good thing. It's a good thing because it kind of keeps you on toes. It keeps you in check. It keeps you safe. You feel you're worried about things, and you have reasons to be. There's something called bad anxiety. When I say bad anxiety, it means things when you're really out of control, where it's getting dysfunctional. You can worry, but you're worrying so much that you can't stop thinking. You're ruminating, and you're constantly talking about it or thinking about it, and it doesn't help you. And that's called anxiety, right? And then we're talking about panic disorders and panic attacks. Panic attacks are physiological presentation. Physiological means something where your body presents with an anxiety, where your heart starts beating so fast, you're shaking, you're tremoring, you can't really think too much. You're blocked in one place. Sometimes people are static; they can't even move from where they are. That's really what panic attack or panic disorder is called. So when anxiety starts presenting, bad anxiety starts presenting into places where you're really your body starts reacting. So we have this system called adrenaline system in our body, which kind of gives us the rush. When something good is happening, we're happy and we're blushing, we're excited and we're joyous, and we have all these physiological reaction to it. And when we're sad, it's also the part of that system which you're crying and tears drop out of your eyes. It's just automatic body reacting to emotions, right? In the same way, panic disorder is an hyper functioning of that system, where you start you're worried, you're constantly thinking about things, and then you start presenting with your body reacting, where you don't have control. You don't want to shake, but you're shaking. You can't think. You're unable to move. Your brain sort of almost shuts, and you feel like something bad's going to happen. Some people actually call it butterflies in their tummy when their tummy starts hurting, and they're constantly complaining of GI symptoms, where they're constantly having acidity, restlessness, feeling like the heart's beating too fast, nausea, tremors, where they're shaking, the hands are shaking, and things like that. So anxiety can be, this is just
So,
a
Afshan, I'm just
yeah.
going to interrupt you in a second here. So, you're
Mhm.
trying to say that anxiety by itself is not wrong. Like, it's okay to be anxious at some level. And it is a normal part of your body's response. It's okay. That's how human beings are. We are made to fear certain things, and we are made to for a reason. Like if you have a fear of falling from some place, it's natural because obviously you're not going to stand on a cliff and just jump off because that's just unsafe. So that's how your mind has been programmed in a way where certain things which are wrong to do, or the consequence of it, or something coming out, your body is naturally going to avoid it, or you're going to feel that anxiety for it, which is a good thing. Or if you have a deadline to meet, or if you have something to do and you're nervous about something, it's okay because that's going to make you do that thing and not have that bad result of it after, which is how you should be functioning. But when it comes to a point where you just stop thinking and you're not able to care for your daily activities, like you just don't want to wake up in the morning or do anything, or you're just shaking or sweating, and there are people around you, but again, you are not able to focus or think, hear anything that's going on around you, and you're just in that loop of feeling certain things, then that is wrong, right? Is that how we would put that?
That's really what it is, Nudrat. I have to tell you, the whole goal of this mental health series or this workshop that we're doing at NMCC is, even if I could convey to even one person, normalizing some of the mental health struggles, right? We normalize, people talk about the acidity so easily, like I have acidity and I'm taking proton pump inhibitors or medication for it. I have diabetes and stuff like that. So the goal really is to kind of normalize these feelings and emotions, right? I mean, we did this talk at ICBC and we were talking about suicidal thoughts. I do want to normalize the fact that these symptoms are pretty common. And here we're talking about panic disorders, pretty common. It is okay. Anxiety is actually pretty normal. It's okay to be anxious. And when you're anxious, it's a normal emotion and it's a normal reaction that, like you said, if you're standing on the cliff and you fall and you're afraid, that's pretty normal, right? Sometimes it just gets a little bit more exaggerated. Let's kind of use the word, it's over expanded in some people. And it's okay. And it's okay to kind of have that. It is okay until it becomes dysfunctional, that it's happening all the time. It's not letting you to live your life to the way you want to. It's all about quality of life, right? If the panic attacks are happening at school, the panic attacks are happening at work, it is not letting, it's time consuming, it's affecting your body. You're constantly, I have people who visit ERs with chest pain, and the doctor gets tired and says, look, we've done all the workup, there's no chest pain, but the patients are not convinced. They're like, no, I'm sure I'm having a heart attack. So that is dysfunctional, right? Then it's anxiety, which is taken over a toll, which is presenting with physiological symptoms. So anxiety is okay. Panic attacks is an exaggeration of it, and we need to talk about that in a way. So does that make sense?
Yeah, absolutely. Absolutely.
Okay. And we've talked about different ways of this is all from my child slides, and we've talked about how kids have different fears, and in adults it's constant worry, fear of unknown, and most often anxiety and panic attacks present with this. In my patient load, I'm going to talk about what general presentation is for anxieties. People have been to the GI doctor multiple times because they have constant nausea. They wake up in the morning and they're throwing up, and they are not able to present with. I have people who have gone to neurologist not only GI doctor, neurologist with headaches. So constant headaches, constant bad feeling, feeling sick all the time, wanting to throw up, constant vomiting. So there's a cyclical vomiting, cyclical nausea, cyclical headaches. People have presented to ER with chest pains. They've had, I'm dying, I have a chest pain, and I'm here. The doctor does an EKG, does all these workup, and they're like, no, you have no problems. Some people report a burning chest pain, burning leg sensation, as if something's bad happening on their legs. They feel like this constant burning feeling. This is pretty common symptoms. Often people have come to me because they've already been to ER 2 or 3 times, and the doctor said, you know what, here is some benzodiazepines to calm you down, and you need to see a psychiatrist because this is really anxiety and panic disorder. So that's often how I have cases present. And then some of the anxiety can also come with other things, these phobias, strong phobias. People have panic attacks when they're really in open environments. They're out there in the open air, and then suddenly they can't go to social environments. So there's a social anxiety, right, where people constantly have this fear. I go to public places and I can't handle loud noises, loud crowd, and then I get into this episode of anxiety and panic disorder. Sometimes people are ruminating, constant rumination, obsessional compulsions about having a certain pattern go in their brain. Sometimes it could be trauma reaction. I certainly feel watching the news and all that, it's really a secondary trauma. I know some of our brothers and sisters are going through all of this trauma there, but us watching all of this is also bringing in so much of anxiety for us, so much of fear, worry for our people. So it could be a trauma reaction to panic disorders, can be a trauma reaction.
So I'm gonna sorry, I keep interrupting you,
No,
but
no, no, go
also
ahead. That's the best way to kind of
I'm
really.
gonna say, and just giving the audience a brief idea that I myself, I am a general practitioner and have been in primary care practice for about 8 to 10 years now, alhamdulillah. So I do relate to that thing that you're mentioning, that we do see people come to the clinic with a presentation of, as you said, physiological is something that all these things can present as actual things to you, which we call as symptoms in medical terminology. But that is something that your body feels. Like it either feels pain, which is the headache, or pain in your stomach, where you feel like you have cramps constantly, or you could be having other sort of pain and presentation too. um, then the other common things are your heart. It does feel that beating fast, the palpitations, as we call it in medical terminology, but you feel that your heart is racing. It's beating more faster than you could have, like you just exercised and came back. But you're feeling that, and then you're also having chest pain. And other symptoms of having diarrhea. Stomach is very sensitive to these hormones, to these chemical neurochemical changes, and the acid reflux is very common. As you said, we have people taking medicines for it. People feel like nothing's helping their stomach. They have a lot of acidity, and that could be a response of that feeling of just fear and anxiety. And more than commonly, we do experience that people say, I don't have a reason to feel anxious. I don't have anything that is going on that I do feel anxious about. And
And that is a
maybe,
big barrier for treatment, a big barrier for treatment because one, we're not educated about anxiety. Two, our body, even me, right? If I had a chest pain and the doctor tells me this is not chest pain, I'm telling you I'm having a chest pain. And what are you telling me? That my heart is fine. So that makes it harder for us to believe that this is anxiety.
but what I would say is do not neglect any of these symptoms. If you are
That's right.
having a headache, if you are having a chest pain, you're having palpitations, you're having that acid reflux, go for it. Go for the right things to do medically.
Mm-hmm.
Definitely, if somebody's having a severe chest pain, I would advise them to go to the emergency room. Go get it checked out. It has to be taken care of. We have to make sure your EKG is okay. Your heart is not the cause of it. Your thyroid is not the cause of it. You're not anemic. You run a few blood tests. Make sure everything's okay. Now, you already went to the best of the specialists. You got every test on earth done, including a stress test, which means that we look for heart attack, and we're pushing your heart to a level where it is really, really working very hard. And if it was to have a heart attack, it would have shown on the EKG or the testings that we do. Now, if that is also not there, everything is done, and you know that this is all of it is fine. Everything has come out to be okay. You got your rhythm check, and still you end up going to the emergency and not being able to do your things and fall back into that, then that's a problem. Then that is where the problem, starts. So you have to sit and think back and kind of sit with somebody and be open to the idea of getting, some help for possibly anxiety, because as much as we know diabetes and heart problems and these things present like this, that these anxiety, depression, these also have symptoms which your body can have, a presentation that your body can show. So just to make that idea open to everybody.
That's right. And more often these panic disorders are often seen in a younger population, young, healthy individuals who on an average um, should not be presenting with physical symptoms of heart problems, right? So I think that's 20s and 30s when you really kind of, not that it's not common, panic disorder is not common in later ages, but first time presentations are usually when you're young and you've just learned to kind of build your coping strategies in life. And anxiety and panic, it's just really taking a lot of stress and your body's saying, and that's my kind of thinking. I don't know what you think. That definitely collaborative care, right? You want the medical doctors to make sure they've checked your heart. You make sure they've checked your thyroid. Make sure you've checked your anemia. You do that part of the work, definitely, but also sort of looking at this from a way. I can't go without talking about gut health, our sleep and our hygiene, and amount of pressure one can take when and that's the part that I really want to kind of bring up is um, we all have different bodies. We all have different stress levels. We all have different times in our life that we can take different kind of stress. Sometimes it's often transitions, like people changing jobs, getting out of college and starting a new job, or of grief or death in the family, loss of job, all of these things, big transitions that we don't talk about or have not paid attention to. So all of this plays a role in how we sleep, how we kind of take care of our body, and how much we're taking, how much social media we're taking, and how much we're putting our body through. So really, panic attack is almost like your body saying enough, saying, this is it, I've taken enough and I'm depleted of my chemicals. And here I present to you how I feel. And kind of listening to that body in a way. It could be less sleep. It could be working a lot of hours. It could be not eating healthy and not taking care of your body. So in a way, it's our body telling you that I'm not feeling well, and this is my overstimulated reaction to how I'm feeling. And listening to that panic attack is so important in so many ways, which is hard to say because often these episodes happen really after you've been through transitions, or you're able to handle the transitions well, and you've not paid attention that, hey, yes, my aging parents, or this happened or that happened, and now I'm presenting with this after a long time. So you can't correlate to it because you've already gone through the trauma, gone through the stress or the struggle, and then you're presenting it. So
We have a
definitely,
couple of questions actually. We have somebody who's raised their
yes,
hand.
yeah. I would just
You may
again
have
pop them.
to let
You
them
wanna?
speak.
No, yeah. Let's get the question answered. I can't open it up for some reason. The way my screen is. Can you open it up, Nadar?
Yes. So the question here is, if someone has burning in hands or legs and the doctors say that it's just your anxiety or stress and recommend anti-anxiety treatment, but the burning still remains, how do you approach such a thing?
That's what I'm saying. It's a very common presentation. One really first, it's all about insight, I say, and we'll come to the CBT part, and I'll explain some of it and that treatment. So we'll kind of get to that part, and then we'll talk a little more about it. Let me see.
So
Uh,
I think the question here also is that despite treatment for anxiety, if the symptoms are still persisting, what is your approach?
Okay, awesome. I think we're at
Great.
this slide. Can you see the slide, right? Without
Yes,
any
I
blocks,
can.
because my block, I have a block on this in the way. Let me see if I can move
Yeah, I'm
this.
able to see a slide.
Okay. Sorry, I'm gonna. Okay, yeah, I couldn't see the part of thoughts. Okay, so here it is, right? We're going to divulge into the part of treatment really in a way. Um, the biggest treatment for panic disorders is CBT, cognitive behavioral therapy. That's the name of the therapy. It's cognitive behavioral therapy. Cognition is your thoughts, behavior is your way you react, and that's the therapy that they really do. And I'm going to talk about this part of the treatment, and then we'll go answer that question in a way. Is CBT, right? It's really your negative thoughts. You're constantly having this negative thoughts. You're having these thoughts that something bad's going to happen, and then behavior is your body suddenly reacting to all of this. Behavior could be how you react, what you do, how you kind of do these things, and then your feelings. You're all sad inside, and your body gets tense, and then you're presenting it in that behavior. And so treatment wise, right? Treatment of anxiety or panic disorder, I divided into, my favorite thing is really a pie of treatment. 30% meds, 30% therapy, 30% your sleep, hygiene, your environment, and 10% you doing the work. You got to put all of this together. So when all of everything is a piece of a puzzle, meds are an answer, but it's a small piece of the puzzle. But you got to put all of this together. We can talk a little more about meds in a minute here, but cognitive behavioral therapy is what I'm really wanting to focus on and talk about it. Burning sensation, chest pain, they're all physiological symptoms, right? And then there's levels, like you start off at 10, then you go to 9, 8, 7, 6, it tapers down. Sometimes a burning sensation, like, you know what, I had chest pain and I had burning of arms and hands. My chest pain is gone, but my burning of arms and hands are there. That just means you need more treatment, right? And meds again are a lot of options, but talking about CBT, cognitive behavioral therapy, is I often do is first step in CBT is insight, um, knowing that this is anxiety. If you don't believe it, you're not going to get help. You're not going to think of it in that way. You're not going to approach it in that way. If you constantly think this is physiological, or sure enough, if the doctor definitely has ruled out and said, hey, we've checked all the medical reasons and we don't think this is medical and you really need help with anxiety, then that part of understanding that this is anxiety is some part of the treatment by itself. Um, One is insight. Two is really knowing who wins, right? Because anxiety is on a scale of 0 to 10. I say, if I treat you when it's not so bad, it's easier for me to treat. But when it's 8 and 9, I have to be more aggressive with med management, have to add more meds to kind of take care of it. So the earlier you treat it, the better it is. And the treatment is knowing that I have anxiety and how do I fight it? The more you pay attention to that burning sensation, and I'm just going to use that burning sensation as an example, but the more you pay attention to it, the more it takes over. It's like playing a video game. It's like a monster. Who wins? You win or the monster wins? Uh, and the part of knowing that this is not you, people start feeling like this is who I am. I am anxious person. I'm going to always be anxious, and this is going to be an ongoing problem forever. That needs to really be separated out in the beginning. Anxiety is not part of you. It's outside of you, and it happens and goes. You have more control than you think, and knowing that if you let that take over, then it kind of wins in some ways, and you kind of say, what is better? Do I fight this anxiety and the sensation, distracted, and initially, right, when you're having a panic attack, it is harder to kind of work through it. But once you create techniques, and the biggest technique I say is distraction, in any kind of situation, because then when you're taking away your body from that feeling and emotion, then you're trying to pull in the other chemicals in your body that are not part of the anxiety. So if you're really having that burning sensation, you're sitting there and you're thinking about that burning sensation, you're going to continue to feel that even more. Versus you get up and do something else, engage your body in a different kind of an activity, it takes away those chemicals that are being released and have you focused on another thing that is. And before you know, you've forgotten that you were having this burning sensation. So it's kind of that work that needs to be done. And then really understanding with the therapist is what triggered this. Something actually triggers it. You may not have to, and it's automatic thoughts. Our body is so tuned. We make this, I just read somewhere, we make about 350 decisions in a day, from which food to put out, what to eat, what to not eat. But this is so automatically done that we don't even think of it. And similarly, automatic negative thoughts are a part of this. Your burning sensation could have happened because you were thinking about something else, and now your body is reacting to it. we can't correlate to that. And my biggest example is really, I like to give this example of eating disorder kids. Their anxiety is so high, they look at a piece of cake and say, I'm not eat this because it's going to cause me 10 pounds of weight gain, or ridiculous, irrational thought about, if I don't do this is gonna, it doesn't make sense, but our body sort of starts thinking like this. And that's how the burning sensation is produced. So we really need to go back and figure out, what was I thinking? What was a negative thought? What kind of emotion did I have? And it will come to you. It'll come to you about this whole connection of how that burning sensation came about. And that's the work that needs to be done. Because once you do that work, you're able to break it down and say, you know what, that's wrong. I didn't have to feel this sad or anxious about this thought. And this thought is wrong. And then when you start challenging that, the burning sensation is treated. It sounds very, I don't know, it sounds very broad, but that's how it really works. Um, so really working on that cognitive behavioral therapy is a big part of figuring out where your thought came from and why your behavior came. There would be no connection that you would have ever thought there was, but there's always a connection, and working through those thoughts is part of the therapy, which is done weekly with somebody who's trained to kind of break down those thoughts with you and work through it. So that's where they are. And if you're on anti-anxiety medications in this, and you have panic disorder, or your symptoms are not resolving, we really have to look at so many options of treatment, right? They're antidepressant and anxiety medication that are taken on long term. They're short-term medication that you take just to help you kind of relieve those pain, take care of things. But it has to be a little more aggressive so we can kind of take care of the symptoms, so they die down, and then work through some of these therapies and be able to participate and engage in it. It's a bit of a work that you have to do with your provider, your doctor, to work through going through those medications. Does that make sense?
Agree, yeah. Well, it does make sense. The first thing, definitely, as you said, is to first make sure this is not something that you have as a medical cause of it. You know, make sure you're eating good, make sure you're sleeping well, you are not deficient with any nutritional things, supplements, anything like that, because those things commonly do give you tingling, numbness, burning sensation.
And you know what?
Um,
Sleep is so underrated, so underrated.
yeah,
Sleep is where all the anxiety chemicals regenerate. And it's a vicious cycle. You're anxious, you're not sleeping, your body's not resting, your brain is supposed to regenerate. Allah's made this whole day and night
yeah,
for us to kind of get that sleep and that be able to rest so we are able to function next. But our sleep patterns are so poor. We don't do circadian rhythms, right? Before we had clocks, the whole rhythm of day and night is you go to bed and sleep at night. We're doing so many other things. We're taking on so much more than our body can take.
yeah,
And really kind of, I would take anxiety in some way of a blessing, in a way of telling that, you know what, we need to kind of take less
slow
on our
down.
body.
Yeah,
And saying resting up, sleep is where all the chemicals regenerate and produce. And if you're not sleeping well, then of course you're going to have panic attack, and then you worry about sleep, because then you're like, I'm not sleeping enough, and that keeps you up sometimes. And so it's a whole vicious cycle that goes on. Uh,
yeah.
and then eating healthy,
There's
vitamin
another
B12.
person. Yeah, sorry. Yeah, vitamin B12, absolutely. That's one of, folate,
Right,
B12. The deficiencies do cause a lot of
right.
these problems. Do though very late in their course, you have to really eat very poorly to have these
That's
deficiencies.
right.
You would have to be, like, as we call in medical terminology, a Tito's diet for a very, very long time, or something, for a couple of years, I think, before you would actually present with a an amount of
That's right.
deficiency to see. Usually today's world, we don't eat that way, so it's very uncommon. Our foods are fortified, but have to
Yeah,
look
it
at
is
what
true.
we're
But
eating.
honestly, I, I've done a fellowship in integrative psychiatry, and that kind of changed some of my perspective about what we think about what diets are. And even in my 15 years of practice, I've seen so much more of um, more diagnosis or more illnesses, or is it more environment, the food we eat, the quality of food we eat. We're really eating a lot of processed food because it's it's there, it's out there, pesticides, I don't know what it is, but really being more conscious about your choices of good plant-based diet, choosing healthy stuff plays a huge role in and then I'm 50-50 on the multivitamin industry. It's a big pharma industry outside of regular approved prescribed meds. Some people say you got to take the multivitamins. Some people say no, it's all a fad. But if you really are having symptoms, I think you got to approach it from uh, looking at your micronutrients and really looking at your gut health. What are you eating? How much of color and how much of pesticides and how much a plant-based diet is? Are you eating enough vegetables and fruits to supplement yourself? Or you're eating lots more processed food and things like that? It plays a huge role.
Sorry, yeah, that definitely is there. Your diet is cannot be supplemented, as I would tell anybody, is you can take supplements, yes, but you cannot supplement your diet. Your diet is very important. What you put in your body is very important. We do have a lot of foods available which are quick, easy, processed. Our trends, our lifestyle has changed. We have become very busy in a way that we want to just grab something, eat
That's
it,
right.
make it quick. It has to be cooked quickly. It's not all the same as it was before, and we want to live that fast paced life. And that's why we are, eating anything comes in comes in our hand. We don't take that time for the three meals to sit, enjoy them,
That's
process
right.
it. With the literature, as far as primary care world goes, I think the most literature for any kind of illnesses or anything is a Mediterranean diet. I think that strongly has literature, whether it's cardiac, heart related, or whether it is any immunological issues, or like your body's immune system becoming stronger, or your memory issues in future. All of them are very supported by the Mediterranean style of diet, and that definitely includes the whole grains, the nuts, the plants, the vegetables, the fruits at its base. And I'm not saying these things are just grab some cereal bar or a bar which has got nuts and grains and stuff. That's still, it's good, but look at what is there inside, and how many things are going, how they're making it. If you can just eat a bowl of fruits, then go for that instead of eating something that's in a packet.
That's
So just those are the benefits of just eating things. Try to know what you're putting into it. If you can make something, go for it. If it's simple, easy, the ingredients are less, that's better than putting in a lot of things and trying to make it, keep it in the shelf for a longer time, and then try to put it in a body. That's just not going to be well taken by your body, and then some way or the other your symptoms are going to come. Again,
And you know
plant
what?
based.
Sorry,
Sorry.
I was just saying, having said that, the holistic approach is such a big deal, right? Meds are not working, but also the illness didn't happen in a day. It happens over time when your body's exhausted and tired of kind of having this chemical depletion. You're using up all your chemicals, and that's where your body anxiety or depression or any of these things present. So it's taken weeks for it to build there, and it takes weeks before you can start feeling better. So on an average, any anxiety medication that you take takes 4 to 6 weeks before it starts working even. So it takes 4 to 6 weeks. Sometimes people are like, I've been taking the meds for 3 days and it's not working. It's going to take time because it did take all that time. So and that 6 weeks means you really start looking at your diet, your sleep, and everything. So time is also a big part of the healing. Unlike some other struggles, if you had a chest pain, yes, you go there, they give you something, and you start feeling better. But with anxiety medication or burning sensations and all this, it takes about good 6 to 8 weeks before the meds start working after being on a good dose, right? So when you start a medication, you probably start on a low dose. You might need higher. 4 weeks later, you're still having the symptoms, then you may have to go up on the dose. But that's how long it takes sometimes for anxiety and panic attacks to heal or get better. Do you get that, Nudrat, in your practice about how it's not getting better quicker?
Yeah, that definitely.
Can you
I'm
hear me?
sorry. Yes, I was on mute. I'm going to 1 second. I have my little one asking for something right now. So that definitely is a part of it. um, the time is something we need to understand that it all depends on the level that it is at. If it is caught early, it may be, very simple, very easy. If it is later, it may be a little bit more hard, more, time consuming. Wouldn't say like the challenges will be there. Its ups and downs will be there. It will be better. It will come back. It is, just look at it just as diabetes. Diabetes, where we have a number to look at. Yes, your blood sugar, you can monitor it, you can do all those things. Your emotions are your kind of your parameters to monitor in these illnesses. You can ask yourself, where am I on this? We have a very interesting thing at work. It's called the mood elevator. They ask you, where are you on this? Are you, kind of bring yourself back from this place to this place? Are you in the negative? Are you in the positive? Wherever you are, you want to come in the middle of the elevator. You don't want to be up, you don't want to be down. So that is very interesting how you get there. At each time, and your rhythms, your routines. And subhanallah, we have, alhamdulillah, we are blessed by such a blessing. Allah subhanahu wa ta'ala has already given it to us, just to follow that, your salah, your timing, sleep after the Isha. That's a very good practice to develop. Don't sit and work after that. Don't have that screen after, because we know that the screen time after that, just before bedtime, it's going to impact your sleep pattern, as well as the amount of sleep you're going to get, how you're going to recover. So that is going to be there. And caffeine, your intake of caffeine, other things that you do. Exercise by itself is such an advantage in these things. We had a interesting article where it said, if you, as doctors, and those was done on doctors, it was on physicians, if you spend 30 minutes in nature every day, your burnout rates are much lesser.
Mm-hmm.
And if if burnout rates are lesser, it tells you that means it is doing something to the stress levels and these neurochemicals, and it is kind of releasing those good neurochemicals that you want your body to have to be able to fight these illnesses. So, just going out, taking a walk, having those 30 minutes of time. And I know we always are like, I don't have the time to do that, but just go out and take a walk in nature. It's important. It is very, very important to come and give your body the time to heal. So I do have somebody raising the hand. Muhammad is asking, wanting to ask a question, but
Sure.
I am not able to allow them to speak. If you can, please, it will be good.
Let me see. There you go. Mohammed, I kind of just gave you. Can you hear me? I think you're muted. Mohammed, if you raised your hand and you wanted to talk.
Assalamu
Yeah.
alaikum. Sorry, I think it was by mistake I pressed the eraser. I
Okay,
have a
that's
little noise with me, so thank you for the addressing it.
sure. Okay. Yeah, no, you bring up that big question of how we can have exercise and stuff being a big part of how we approach this. And there's a huge study on how endorphins are produced when you kind of exercise and take care of your body and take care of the panic attacks in some ways. But I think the biggest part that, if anything, I want people who kind of understand panic attacks and the struggle is really knowing that take-home message is you have more control than you think. And I mean, I'm going to quote this example. I remember me having, I went scuba diving in the first time, and I thought they taught me scuba diving from the water, and then they take you and they drop you in 30 feet. And I remember first time around me having and understanding this panic attack was I knew I was going scuba diving. I knew I was sitting in a boat and I'd be dropped in the water, but knowing that I'm going to be dropped 30 feet in the water right then suddenly hit me when I was dropping in. My body was supposed to sink because I'm tied with stones, but I couldn't take it. I was just like, I can't do this. I had to come up and things like that. The same thing happened years later, and it comes and goes, right? Panic attacks are something that can come and go. I got stuck in an elevator in my Hajj, and I got pushed at the back. So every time I saw a crowd, I do get anxious. But I understand all of these trips involve lack of sleep, having to transition, working through so many things. So really giving my body that chance to heal and kind of talk about it and be able to understand what it is and saying, you know what, my body's telling me that this is too much. And fighting it sometimes when I kind of feel the urge that I'm sleep deprived and we're traveling and we're in crowded places, I can see it coming in a way. And I have to say, look, I know it's coming and I need to work through it. Feeling a little more controlled on it, then you feel like you have less control. So important. Zara, I see you put your hand up. I'm going to try to see if I can get you to. Sarah, did you want to talk? I have a question.
Yes, I did have a question. Assalamu alaikum. How are you?
Wa alaikum, alhamdulillah. How about you?
I'm good, alhamdulillah. I was just wondering about anxiety and how it can kind of, I guess, cause incorrect decisions, and it can be so much that it stops you from doing your day-to-day functions. So how do you combat that? Like, how do you stay focused? How do you concentrate with all this going on?
That's a very good point. I think the first fact that you brought up and you said is how anxiety and depression play a role in decision making. People don't understand the kind of, it's anxiety and depression really is quality of care, right? And quality of life, right? So we're not talking about how we're doing and how this is affecting people around us, our family. Sometimes we get so dysfunctional that our decision making people, and there's a lot of studies on how people make poor decisions because they're depressed or they're anxious and they're not going out and living the life or the quality of life they need to, and because they're anxious. I think the biggest part is you're afraid that this anxiety, this panic attacks might come on when you're going out. You're afraid, and you're not able to focus and pay attention because you're constantly in this mode of feeling on the edge. That's what I call it sometimes, having an anxiety attack. And you're always, I think it's really kind of figuring out first, knowing that you have anxiety. And second part of that really involves working on figuring out how you get the treatment. And it goes back to the same board of the treatment pie is 30% is definitely meds. So really figuring out with a doctor or a provider saying, hey, I've got anxiety and I need to treat it, just like you treat your diabetes, just like you treat your hypertension. If you went to a primary care physician saying, hey, I've got diabetes or hypertension, they're going to say, look, you got to work on your sleep, you got to work on your exercise, and you got to work on your medication. And the same way, anxiety is the same way, and the panic attack, really finding meds. And sometimes, and everybody's different and every medication is different. Everybody tolerates different doses. And sometimes people often, what I see in my practice, people get dejected. The fact that I started meds and it's not working. Well, this might not be the answer. There may be another choice of medication we need to try, and figuring that out, giving it time, 4 to 6 weeks. Like I said, meds takes all that time for us to work through it. So we got to work on that. And then really working through giving yourself that time. If you can make decisions, really saying this is the time. I often call self-protection, right? The fact that I have been watching the news and it's taking a toll on myself. And as much as I don't want to watch it, but I do want to watch it because I feel guilty that I'm not being there for my brothers and sisters. But there is something called self-protection. When you're really going through depression and anxiety, you have to create this invisible walls and say to yourself, you know what, this is not the time for me to take this on. This is not the time for me to kind of work, and giving yourself that space to say you're not doing well. Because when you're physically ill, it's so obvious. If you have a fracture, people are like, you can't walk, you need to kind of go do physical therapy, you need to kind of do these things, or you can't do that. But when you're mentally not well, it's hard for people to understand, see it, because you are feeling in the suffering. It's hard for people to see that you're suffering, you're kind of struggling. And that's the time to say, you know what, I'm not I'd be fine later in 6 or 8 weeks, but right now I'm not. So creating that invisible wall in terms of all the negativity that comes your way, toxic environments, toxic people, toxic stuff, having to make decisions, all of these things, you sort of say, you know what, giving yourself that space and saying, I'm not doing well. I need to take a break from doing things that need a lot of concentration, attention. And as a parent or as a mother, as somebody's working, it's sometimes hard to kind of say that loud enough or say that, but I think really kind of that's where it goes back to the fact that we need insight. If we know we have anxiety and we understand that as any other medical problem, we're going to say to ourselves, I'm going to take a break from this. And it's called self-protection and being a little bit selfish. Although selfish has such negative connotation, I say being selfish for yourself is so important when you're kind of going through depression, anxiety, and saying, I can't do this. I can't make these decisions right now. I need a break. I need to go take sleep. I need to not pay attention in things. Did that sort of answer your question?
I think there's something similar in the Q&A also. Like if you're on medications and these thoughts, the negative feelings and thoughts have kind of put you in a frame of mind where you're not able to concentrate, have conversations, be yourself, and you make incorrect choices and things like that, what would you do? Again, as Dr. Khan said, medications, yes, are a part of it, but to understand that these illnesses or anything for that matter, it's not a quick fix. Like I'll give you something and tomorrow you'll be all fine and you'll be able to make decisions like absolutely as you were, a year ago, and you'll be like fixed. No, that's not how it goes. It does have its course. It does have a time to understand yourself, to understand your environment, to work through that process, to work through your thoughts. Sometimes, as we had a discussion before of Shan, and to sometimes just sit with your thoughts. It's not wrong to do that. Yes, you have a thought. We all have thoughts. We all have positive thoughts. We all have negative thoughts. It's a very good, there are many exercises actually, if you do the therapy with a therapist or even coaches or however, you can work through your thoughts. Sometimes just writing it down and then like a flow chart, just writing it down. Okay, this is it. What is it going to do? This. Okay, how? Then just sometimes reading it back to yourself, it's like, really? That's what it's going to, how can I be thinking that it's going to do this, and these things? So when you do those exercises, it makes you process that thought in a way that you'll be able to make yourself understand that, no, these thoughts are there. So I'm just going to let this one go, work on this one, work on that one. Those kind of things are important to do as you would get your journey towards healing through this. And everything is important, as you said, taking time for yourself, that correlation of putting your mask on first before you put your child's mask is always there, and you need to take care of yourself so you can take care of the people around you. They need you, and absolutely this is a part of that if you are in good health physically and mentally, then you'll be able to take care of everyone around you and not only just thrive in that environment, but also you'll be able to be very much more productive. You'll be able to function so much better, and you will see for your own self that you've done so well.
Yeah, no, and definitely, I mean, we can't go away from not talking about perimenopausal symptoms, right? I'm in my 40s and I kind of feel a big change in how my body's reacting to things and hormonally kind of knowing my brain's still at my 20s and my body's at 40s. And so really kind of saying, I can't take this on. I can't do all that I wanted to do for my kids and my family like I used to be able to do that. Giving yourself that space, really understanding that your body goes through changes and there's something called hormones and your hormones are changing and fluctuating, and really responding to your body the way it is. And honestly, anxiety is really panic attacks. Your body's telling you that this is enough. This is enough. You can't do this, and you need to kind of take a break, and really understanding that. But there's so much of expectations from where we are and we want to do and what's out there for us to do, and how much we sort of say it's hard. It is hard to kind of put a break on things and saying, I need to take care of myself. And that concept It's so hard. And the other part is really my biggest barrier, like I keep saying, is the take-home message from this really is anxiety is pretty common. I want it to be understood from just as diabetes and hypertension is understood and be said. And honestly, I've done this for 15 years and I really feel like I can't think of anybody who's not been treated. And I say this with a little bit of confidence because we might not have taken care of the anxiety right away, but we as psychiatrists, we rarely say that we've not had people control the anxiety. So we're able to, there are medications, there are treatments that the first might not work, the second might not work. We might need a combination of things, but it's very treatable. You just have to work with a doctor and kind of work in steps to figure out where it is. It is cyclical. So sometimes people have done really well and they're like, I don't think so. This anxiety of mine is going to go away, my panic attack. And I'm like, trust me, it will. Give us some time and weeks. And we're there. And then they're gone from my practice 2-3 years. I don't see them. And 3 years later, something happens, a transition, and I see them back. So it can be cyclical in a way that it comes back. But there are options and medications that actually can treat the panic disorder and can treat the anxiety. Just finding the right ones and working through that medication. And then the CBT, right? They are tools, they're coping tools that I want every adult to have in their belt that they can pull out. Because then once you sort of work through this, you're like, I can identify this. I can use distraction techniques until I work. And it's really kind of saying to yourself, like I said, insight is a big part of knowing that this is anxiety and I need to treat it. Once that comes in, then you start taking steps towards that, saying, you know what, I got to be a little selfish and I can't take on this person, this thing and that thing, and saying, I don't need to take all this on. That work. Then you're really challenging and figuring out the connection is, as much as I said, people often come back and say, I am not stressed and I don't know why I'm having panic attacks. It's totally related to transitions, trauma, big dips where your chemicals have been used and then you're presenting with it. It may be a little away from it, a month to 6 months, but it's always connected and really working on the thought process of where did it start? Where did it start? And once you do the work once, even if it comes back, you've known how to work through it. And that's the part. Sarah, does that answer your question?
Yes, it does answer my question, but you had mentioned that you kind of have to be a little bit selfish and kind of put yourself before others in order for yourself to heal. But there are situations where you can't do that. If you're a mother, you're dealing with anxiety, and you can't just say, okay, sorry, baby, I can't take care of you right now. I have to deal with my own anxiety. That's not an option. That's not an option. If you're an employee, that's also not an option. You can't just not work just because you have anxiety. There's, so like, how do you
It
do
is
things?
harder, definitely, right? I mean, but I'm going to kind of talk from an employee situation. There is, when anxiety starts happening, you're pushing your body, you're not taking the work. There is something called FMLA. You got to say, you know what, I need to take some amount of break. There's mental health breaks that you can take and kind of create that, but also aggressively treat it, right? You go to the psychiatrist or your primary care physician and say, look, I really need that anxiety, taking the meds. Sometimes the first med might not work, taking the second med, taking that break. Sometimes I think more often anxiety is seen in people who are very type A, as in they're really hard on themselves. There's a bit of perfectionism. Nothing lower is expected. And that kind of brings in a lot more anxiety in some people than other people in a general way. And really kind of figuring out being good enough as a parent, right? That's the biggest thing I say as a parent for us is in this world of we want our kids to do 1,000 things and expect them to do fine. We're loading them up and ourselves so often that and for me, anxiety is sort of like cough, like I said in the beginning, is you cough, you give it to your child, you're seeing it. Because I would take my kid and say, hey, I was coughing last week, my child has coughed this week. But anxiety is exactly the same way, where if you're not being selfish, not taking care, then we're really transferring that anxiety. Kids are like sponges, they take it on. My biggest example is I get in the car and I'm rushing my kids to school. I'm like, get in, we're getting late. And my kids are like, we're going to HEB, calm down. So that's me transferring my anxiety, right? Because I'm constantly on that rush wanting to do things. And sometimes I just have to say, all I have to be is good enough. If they miss some classes, it's not going to be the end of the world. If they don't do some activity, it's not going to be the end of the world. Really kind of taking that break and giving yourself that time. And it is easier said than done. We're all guilty of kind of being on that edge and wanting to do things But when I say being selfish is really saying, it's okay. It's okay not to do certain things, and it's okay not to. And as a parent, I just have to be good enough. There's no perfection in it. But kind of sitting with that in that moment and just saying, if I can just cuddle and sit here and not do any other activities, that's fine too. I know it is hard, but
I guess the other question also here is, we are living in a lot of us, most of us now, nuclear families where we don't have a lot of some of us may not have that support, may
Yes.
not have that, something to take care of our kids when we are actually going through and break down emotionally ourselves. And then what do we do? What do we actually do in that situation? You can't just shut everything down and say, sorry, no food today, I'm anxious. No, that doesn't happen. So probably also working through that is, so sometimes it may come on and you may realize, hey, this is a time where I may not be able to, if I'm starting to feel sick already. And like if you have cough, cold, something, and you're going to be down with flu, you apparently cannot get out of bed because you're in pain. You're really in pain. Your body is hurting. You have a high grade of fever. You cannot go around people. You'll be transmitting the infection to your kids. So you are avoiding that. So having that kind of a backup plan that, hey, I have these things cooked up, these are there. Little kids, it's very challenging. That's probably toddlers and younger infants. That's where I guess that bigger challenge arises. What do you do? Then getting that help, that support around you in some way. And I think that by part is also our responsibility as community members to create those platforms at a larger scale and make sure that we have these support systems in place for people who can approach and kind of get help in a way or the other, to reach out and be like, hey, can you take care of my child today? Even if it's an infant, milk is here, this is it, a couple of hours, and you can come back and take care of the other things. And this, by part, another goal here um, is also to make people around realize that it's okay when somebody is having that panic attack. Give them the time. And I recently had that experience in a community gathering where somebody was having, where we see people having panic attacks and we go to them like, what's happening to you? It, you going and just asking is going to worsen that person. So sometimes leaving them alone is the best thing to do. Let them get through their panic attack. Let them breathe. Let them have that space. Give them that. Let them go in the open air. If they have social anxiety, taking them out of there, and just being okay with people having anxiety or these feelings is important, because we don't all have to be the same. What makes you anxious may not make me anxious. I may be able to go scuba diving, as you said, and not have any fears, but you had it, or those things. It's different. Each of us has a different challenge at a different level.
And the goal
Recognizing your
really is
own.
bringing in awareness, right? That's the whole
Yeah.
goal of this, is we be able to sit somewhere and say, you know what, I have anxiety and I have panic attacks. And I may not be able to give this example to all my friends because not everywhere people are aware to be able, but there are some friends I can go and say, you know what, I understand panic attacks and I had a panic attack and it happens all the time and it's okay to talk about it. Really creating that circle for you to be able to really say, this is where I'm struggling. So people are a little more kinder to each other, having that resources. And like I said, if the goal is that if you can identify it early, it's harder as a provider or a psychiatrist for me to treat something that's really far out in panic attacks. If you're having those panic attacks every day, then it makes it harder for me to treat it and be more aggressive or add more meds versus when you're having panic attacks in the beginning. And it doesn't go from 0 to 10. It actually comes from 0 and the 0 goes to 2 and then goes to 4 and 6. If you meet me at 4 and 6, it's easier for me to treat you than when you're 8 and 10. Then it takes longer, it takes more medication and things, which is hard to kind of first take in because you're at 8 and 9 and you're now suddenly being told all these chest pains of yours are actually panic attack. And you're like, no, it's medical. No, it's not. It's anxiety. And then you're supposed to be treating it aggressively and take more meds that you've never heard of, talked about. So the goal is to create this awareness, is to be able to say, you know what, actually, this is anxiety. I've heard of this and I understand this. It brings back to that question I was talking about. Somebody's kind of said, yep, anxiety and fear are similar things. Like I said, evolutionary, we were like predators. We lived in open jungles. We had to survive. And so anxiety came from a part of that fear-based model and really worrying about doing the right thing or the wrong thing. But the difference between fear and anxieties, it could be the same in a way, but at the same time, when it gets dysfunctional, fear is normal. It brings in positive results, but anxiety is getting dysfunctional, that you're not able to participate in things, you're not able to live life like you is. And that's where I treat things. I say everybody can have depression, anxiety, and it's okay to have those. And calling when it gets dysfunctional, that you're not being able to go out, you're not able to function, you can't go to work, your family is affected, then definitely it's anxiety and it needs to be treated. And combating the negative thoughts, how would you combat negative thoughts? It goes back to really kind of working through figuring out what those negative thoughts are. Sometimes panic attack is, oh, I'm going to die. This is it. I don't want to leave my kids behind, or all kinds of things that come immediately. And then you're thinking, why am I going to think I'm going to die? And then that kind of comes back. Tawakkul is the biggest thing I often say to people. Believe in Allah. Whoa. We all have different levels of tawakkul, and we have different levels of spirituality and where it stands and what it stands. And to anybody in my practice, I say religion is a big anxiolytic. Really knowing that you're not in control and somebody else is in control is a huge relief. Knowing that Allah Ta'ala has kind of given this world, and every time I have any kind of anxiety, is me feeling I'm wanting to control something. And that's really the root cause of anxiety and panic attacks, is wanting to control things. If it's things are not losing somebody and you're not wanting to lose, that is anxiety. Having things that are like taking on more than you can, and you want to keep your family together, keep things together, is so anxiety. Basic root cause is controlling, and that's why people who are type A are more prone to anxiety. People want to control things, and that's exactly what's opposite of what our religion teaches us, is you're not in control. Again and again, there's so many verses in the Quran telling us that, you know what, I control everything, even from a small leaf to a little second of what's happening in your life. But really kind of bringing that spirituality, that tawakkul in our life, to say, I don't control anything. What am I afraid of? And working on it. How would you address being very repetitive, asking same question, not realizing, remember what you said and what was being told to you? Rumination and constant needing constant reassurance is a common anxiety symptom. Comes from the fact that goes back to control, really feeling like something's bad's going to happen and you're feeling like you got to want to control it. That's why you're asking these questions and working on it. I say a 1/3 rule for more often when you're kind of going through this with parents, especially kids who are really ruminating and constantly. The 1/3 rule is you answer the question 1/3 of the time. 1/3 of the time you completely ignore as if you didn't hear the question. And 1/3 of the time you really sit down and kind of address it in a little more detailed way. So sometimes it's sort of gambling with your brain. That's again kind of having a little more control over your brain, is saying, why am I thinking this? Sometimes you really work through those thoughts. Sometimes you distract yourself, say, you know what, right now I'm not going to give this ruminative thought more time. I'm going to go do something, watch TV, read Quran, do something else, because then you're taking away yourself from that heavy chemical induced moment to a different chemical induced moment. Changing gears constantly to kind of not, and then you say, I'll come back and address this question in this thought of mine, but right now I'm going to do something else, and working through that. We all have to create our own coping skill belt, I say, that you can kind of go back and fall for, to figure out what works for us and what doesn't work. And that's where cognitive behavioral therapy and a therapist, because as you unwind and you talk to your therapist, you figure out what your techniques are and how you work around it.
I'd like to just say something here. Is it again, it depends on the age of the person also. When you're asking a question repetitively and you're not able to remember it, there could be more aspect to it, because your brain has areas where you can have problems with concentration, and that's why it never registered in your mind. Or you could also be having significant memory issues, and that's why you just actually did not remember and somebody answered that question for you. And so it all depends at what is the presentation of the person, and who is it. If it was a a 65, 70-year-old person who's just suddenly slowly kind of repeating certain things, I would look into memory and those things. And definitely mood is a part of it, but it could be anything. So just kind of keeping that idea open.
Yeah. And, we were pegging ourselves to a certain way of life altogether. We got to work, we got to send our kids to schools and do all of these activities. We got to be on social media. We got to have all this Pinterest homes. Sometimes you really have to step back and really reanalyze. You can do all of that, but when your body's saying, no, I can't, I'm anxious right now, but step back and say, I give myself an excuse to be lazy. I give myself an excuse to kind of let go of all of these things and take care. And that's when I'm saying life is all about phases, right? So we got to kind of give ourselves that option to say, I don't have to play this game right now when I don't want to, and taking a break and really taking care of yourself. It's honestly, you'd be surprised how often as a parent too, I can kick off so many lists of things that I don't have to do when I'm not feeling well, but I push through it. And then I see the consequences later with my emotions. And that's where the work comes in. Before we're now at the consequences and we want to kind of fix it. It's a bit of a delay there, and being more self-aware and being more open and reflective, and really reflecting constantly to bring that change in your life to make things better, is the work that we all need to do. And that's what really kind of goes back to our religion and talking about reflection and pondering on what really is important, what's not. Yeah. Any other questions?
I don't see any questions. If anybody still has anything, I still ask you to raise your hand or type in your questions the next 5 minutes, and then we'll kind of wrap it up here.
Yeah, no, before
Just
we wrap up, I briefly wanted to go through the options of medications, just so we have a
oh,
little
okay,
bit of
sure.
education, right? In my practice, we do a lot of integrative psychiatry. So my approach is more on the holistic approach. Like I said, my favorite pet peeve is this treatment pie: 30% med, 30% therapy, 30% environment, and 10% you're doing the work. You got to put all of this together. You can't expect meds or therapy or not changing your environment to do that. So sleep and work and exercise and hygiene all should be part of any other medical illness, regardless of psychiatric illnesses, right? So we do that. Meds wise, they are the antidepressants. They are the SSRIs, the Zoloft, the Prozacs, the Lexapros that help with anxiety. Kicks in within 2 weeks, see more effects in 4 to 6 weeks. You got to meet the doctor. Sometimes we start people and you may not have good effects. You may have some side effects and might not be working, you change it. But that's the process of really long-term treatment. Short-term treatment, there are a lot of medications. If you went to your primary care physician, and that I'm not generalizing this in some ways, but sometimes your primary care physician is desperate to help you, and they give you something called benzos, which are the Xanax. When you go to the ER, you get all of these Xanax, Ativans, and stuff that sort of stops this panic attack right away, but does not really treat it. And there are options. Sometimes you take it too long, you might get addicted to it. They're a quick fix. They can be taken and it helps to bring the panic attack right down that minute. But along with that, you got to try the antidepressants to work on it. There are other options like gabapentin, Buspar, some other anxiety medications you can take, like even Benadryl hydroxyzine, which helps you kind of, does not treat the anxiety, but brings the anxiety down by a notch from 10 to 8. So there are a lot of options in medications and to kind of work through, but you got to kind of stick with the doctor, work through it, and figure out these options. And sometimes on an average, I say people have to take the medications 6 months to prevent relapse 2 years. But if you work with a doctor, you start the meds, work through it, get better, and slowly taper the meds off without kind of drastically doing, because then it might bring back those attacks, and working through those chemicals. So 6 months on an average, you take the meds. So they're just like your blood pressure medication. That's just like your diabetes medication. In fact, you can actually get off these meds as you start doing better, because you've added more tools in your system to identify it early. You have more insight in the illness now. You're able to have a team who can work with you, and you can get off the meds. So yeah, those are the options. And then we, in terms of supplements, like I said in the beginning, I've been 50-50 about the multivitamin industry, but there are lots of micronutrients, healthy eating, more plant-based diet, looking at food. So there are a lot of micronutrients in the market that treat you. Over-the-counter supplements like L-theanine that kind of help you support that system. I'm happy to answer more questions if you all have over-the-counter meds that people want to take. My email address is my first name, last name, md@gmail.com, or you can find me in Austin Family Psychiatry and reach out from there on my email, office manager at austinfamilypsychiatry.com. But we can talk about those options while you work through therapy. But all of this has to be done in conjugate way to kind of get those results. So really working through these are a lot of options. So you got to, one, understanding it, not ignoring it, giving yourself that break and treating it. It's all going to be part of that whole treatment plan. That's really it. I just wanted to kind of run through that before. So there are different meds and different side effects. The most common side effects are nausea, GI symptoms with our antidepressants. They usually go away within a week or two. For younger kids, there's a black box warning of increased suicidal ideation with antidepressants. It's pretty controversial. When they did research, 1,000 people, 14 people scratched themselves. So they had to put it on the box. But I often say, if you have a good doctor and you're working through it, it's nicer to kind of check in with the doctor more often in the beginning to get on these meds, monitoring it, and then going from there. But usually in 2 weeks, if you're really depressed or you're anxious, within 2 weeks of starting the meds, you start seeing benefits, feeling much better. And then in 4 or 6 weeks, the panic attacks decrease. But everybody has different reaction to those meds. How do you approach and know that? What is your?
In primary care, the approach is mainly serotonin receptor, the SSRIs most commonly, and that's how I go by it. I do not commonly use the anxiolytics like the benzodiazepine agents in the first place, because I know I treat more elderly. So for me, they have their own side effects. They come with their own baggage of risk of falling, risk of memory impairment over the long term. If they get addicted, it's a problem. So usually not that commonly, but in certain cases you need them. You cannot avoid them. It all depends on a very case-to-case basis. If somebody is so paralyzed that they cannot do things, everything is short-term, could be short-term, could be long-term. It depends. You have to have a continuous follow-up with your primary care doctor, psychiatrist, your entire team, of doctors, so that you are able to get your treatment in the right direction. You just don't expect a fix one time and then don't go. And sometimes one of the things that we know in certain kind of illnesses, not necessarily for anxiety always, but it could just be that just reassurance from a medical professional that no, hey, the chest pain is not because of this, you're okay. But yes, I'm not saying you don't have pain, you do have pain, but it's not because of a heart problem, which is a very good thing. So we're just going to work through this, and then we're going to see how it does. And surprisingly, you do see that go away or decrease slowly, and you see and notice that change slowly over the time. So it's all doable. It takes time. It's frustrating sometimes because you've done all these things and you think that nothing has helped me, and what's going to be the outcome of this when not all this is, it's just not working. And it takes its time, but it does happen slowly, one step at a time. Tiny, bite by bite, small things, and it's going to be there. We have a couple of other things.
There's a question about propranolol. That's a great medication. Like I said, when I divided the meds, I said one of those meds which sort of not treat the anxiety, but brings the anxiety by notch 1 or 2. Propranolol is one of those medication. It came out as a blood pressure medication. It controls the blood pressure. So it really takes care of like I started talking about the anxiety and the physiological where your body is reacting. It takes care of that autonomic system and shuts it down in a way. So yes, people take it often for performance. People who have speeches to give and they're very afraid, it kicks in within 10 minutes, stays in your system 20 minutes. Not so great thing about propranolol is because it does not treat the anxiety. your anxiety can be where it is. It's just treating the symptoms and not treating the anxiety. Two, it has some rebound blood pressure issues, but often used as an everyday medication twice daily for people who are going through anxiety treatment. Yes, you can take it before you feel like you're going to be anxious in situations, but if you start using it every day all the time, then it's time to talk about maybe it needs more of an SSRI, the serotonin antidepressant medication treatment. Occasionally, once in few weeks, you are anxious because you have to go do this presentation in your class, or you have to do this presentation at work, or then it's fine. But if you're taking it daily, then we really need to talk about treating the anxiety on a long term. Can anyone on short-term disability from work yes, so FMLA for generalized anxiety disorder and panic attacks is a thing. Can you be fired? You can be fired for taking FMLA. The question is, I tell people that if your anxiety is this bad that you can't function, you can't go to work, then we need more of aggressive anxiety management, which means sometimes it means aggressive treatment. I can start the meds, but also I need you can't take an FLA, stay at home and say, I'm anxious and I'm not going to work. I'd rather you be involved in intensive outpatient therapy. So when you look at psychiatric module of treatments, it's the inpatient where you go stay 5 to 7 days because you're unable to function, not able to, or for safety assessment because you're really having negative thoughts. Then there's the PHP or the partial hospitalization program, which is 9 to 5. You go there morning to evening. It's aggressive therapy, session after session for 4 to 6 weeks, insurance paid. There's another module called IOP, intensive outpatient, which is in the evenings. You could be going to school and work and be doing that for 4 to 6 weeks, insurance paid. So if you're really at the point where you can't function at work, then you really need to be somewhere 8 to 3 doing some therapy. So I'm all about kind of taking that FMLA, taking that break from work, because if you're not functioning, you're going to get fired. So you might as well go address that by getting into intensive outpatient program, PHP, take meds and work through it. So yes, people can take FMLA for generalized anxiety disorder, and people can, but they want to take care of it and get it treated. So that's how we approach it in our practice. Yes, so no, we appreciate it. The goal really is to take home message of understanding anxiety, just like diabetes and hypertension, really giving yourself that space, having more insight, treating anxiety. The biggest thing of CBT, cognitive behavioral therapy, for me is knowing that this is a monster outside of you and does not belong to you. And you got to say who wins, the monster or you, and working through that module and saying, what do I do? Not let this anxiety panic disorder monster win over me. And working through that. Yes, inshallah, we've recorded and we've been good at it. Sometimes we forget to hit the recording button, but I think we did a good job, Nudrat. We hit the recording button, and this should be available, inshallah, on NMCC's website and their YouTube channel.
Sorry, I had missed that last part because I actually got distracted with something.
No, it's about
Yes,
recording. I said we did a good job. We hit the recording button. Sometimes I forget to do that.
Oh, alhamdulillah. No,
So, alhamdulillah, we've recorded and it should be there. And
inshallah.
thank you. Those
And
were
if there's
good
anything
questions.
else, you have your resources available, your email address and your practice.
That's right. I'm on Austin Family Psychiatry, and my email address is afshankhanmd@gmail.com. Happy to answer short questions. No big love letters. I can't take big paragraphs and stuff, but short questions, I'm happy to help. There's a lot of over-the-counter stuff that I'm happy to even suggest people work through. This session didn't allow us to but if there's an individualized question about over-the-counter support systems, I'm happy to talk about it on the email. Y'all can reach out to me, and I'm at Austin Family Psychiatry.
Thank you so much. Jazakallah khair. May Allah reward you for this. And again, alhamdulillah, thank you so much for attending today, to all of those who have participated and to everybody who might be listening. Allah subhanahu wa ta'ala make this beneficial in any way. And anything that good comes out of it is from Allah. Anything that is, not correct or misgiven, and forgive us for our shortcomings. Inshallah, we will continue to have these sessions every month and see you all, and provide as much as we can resources. There are many therapists who are there on MAPS Austin, and that's the Muslim, the psychiatrists. They have a website called MAPS Austin. If you just look that up, you can see them, you can contact them. and inshallah that you can, get that therapy help if you need, and schedule sessions with them. There is integral care. There are other community programs. There is Lone Star Circle of Care, community care. They have their psychiatry services also. And you can get in touch with your primary care doctors. They can definitely start off with something and then start, get you on the right track, inshallah, for whatever. And if you take anything from here, just start eating one vegetable a day, just one thing, just do small things. I like to make it that simple, easy. It's tiny. Start a little bit and then just walk for 10 minutes. Something, just start off with something, see how you do after a month, just one habit a day, and then maybe just building those is going to take away a lot of that emotional distress from you, and help you, inshallah, have good and healthy life. And then I will also end with a dua, inshallah. As we have in our deen the duas that we make in the mornings and the evenings, and we ask Allah subhanahu wa ta'ala to help us get through our days with His help. And if you feel anxious, Rasul has the dua for that also, for a reason that this is normal. Our feelings are going to be there. They're going to go up, they're going to go down. You're going to have these moments. Some days are good, some days are not so good. This is all a normal physiology, as we call it in medical terminology. It's normal. Human beings are created in that fashion. So just accepting that and moving on, and that's important. Each of us is different. So, alhamdulillah. Right. Thank you so much, and keep us in your du'as, inshallah. And we'll see you guys next time.
Psycho.
Bye.